When you're listening to someone's heart with a stethoscope and you hear those two sounds, lub dub, lub dub, lub dub, that's not the atria contracting and then the ventricle contracting. That's not the lub dub. It's the valves, there's 4 of them, closing. And as they close, they sort of snap shut. And that's the sound you hear. Now, there's 2 valves on the outside, and those valves, starting from the right-hand side, that would be the tricuspid on the right, you try to be right, tricuspid valve, and then the mitral valve on the left-hand side. They close at the same time, and that gives you your first heart sound. It's called S1. That's the lub, right? The outside valves closing. The 2 valves in the middle, they're your semi-lunar valves, meaning half-moon valves. And they are the pulmonic valve on the right-hand side and your aortic valve on the left-hand side. And that makes the second heart sound when they close together. So you've got lub on the outside and dub in the middle. Lub dub, as they close. But if they don't close at exactly the same time, then those heart sounds, they get split. So you might get lubub dub, lubub dub. If you've got, say, mitral stenosis, stiffening of the mitral valve. Likewise, if you've got aortic stenosis, if that aortic valve in the middle next to the pulmonic valve, remember those 2 are supposed to close together, if one of them is stiffened, like an aortic stenosis, then you might get the pulmonic valve closing just before the aortic valve does. So you might get a lub dubub, lub dubub, yeah? And if like the outside ones and the inside ones are stiffened, then you might get 4 heart sounds, lubub dubub, lubub dubub, lubub dubub. So, lub dub's normal because it indicates the valves are closing, they're snapping shut, they're nice and compliant, and the heart's beating in sequence. If you get more than 2 heart sounds, consider getting somebody else to have a listen to the heart sounds and do an assessment on your patient, because that's not normal. There should only be 2 heart sounds. Lub dub, lub dub, lub dub, lub dub, lub.